Pamela Kapand, who is emergency physician in Niagara Health. And we also have Dr. Salome Weirdo, who is a pediatrician in Brooklyn, New York, in a hospital out there. And so I want to thank, on behalf of Leading Ladies, I want to thank all of you for joining us tonight on this important discussion. A disclaimer, first of all, just so you know, for all of our audiences, we are healthcare professionals, yes. However, we are not your healthcare professionals. So any health concerns, please discuss that with your own GP or nurse practitioners, anyone in your own circle of care. This is a discussion, opinion-based only. Yes, we will take your questions. However, we are not to discuss your own personal health conditions or issues, okay? And so without further ado, again, as I have discussed earlier, I will leave the floor to our panelists here. The first question here of the night is, why is this important? Why right now, September 13th, why is it important for us to discuss this yet again? Dr. Weirdo. Oh, you're on mute, you're on mute.
Mute.
This is super important because we are really at an inflection point, I feel. And we really have a chance to really put this pandemic to bed. We are at a critical juncture in this pandemic. And unfortunately, there still continues to be too much disinformation, information from unqualified sources, from sources that really aren't the authority figures that people still consume and unfortunately, put into practice and take as gospel. And so, we need to give information that is factual and, without bias, that will actually help people, help save lives and help us to get over this pandemic once and for all. I think really right now, what is critical is the vaccines. And it's critical that people get, the factual information about vaccines, about the vaccine passports, so that we can actually get, more people vaccinated and get over this thing.
Yes. Do you think that it's a bit optimistic to say that we have a chance to put this pandemic to bed? Are we speaking way too early here? I mean, we are, again, at the time when we had the discussion, we were out of the second wave going into the third wave, and now here we are on the fourth wave. What do you guys think about that?
No, I agree. I think that it is a bit optimistic to state that we're going to finally get rid of COVID. I think COVID is here to stay. But what we're trying to, I believe that what Dr. Weirdo, sorry if I said it wrong, you'll have to correct me, is also trying to emphasizes the fact that we are trying to no longer go into waves after waves after waves of, quite significant strain in our healthcare system, as well as strain in individual lives, people dying in very large numbers. And of course, kind of looking in our neighbors down south, if you're looking at 600,000 people have died over 19 months, that is significant from one disease. And so I cannot, as a practitioner, you cannot put that beside. Those are lives that have been lost. And so with this, the hope is that we can curb that and that we cannot have this type of tragic losses that could be prevented. And perhaps that's the discussion that we should have today.
Yes, absolutely. I do agree with you, Dr. Kapand, that, I think the discussion cannot stop. We need to continuously have that reminder about COVID. And now it's not only so much about the fourth wave, but it's the variants coming out of it. Let's talk a little bit about that. So why are we in this state where we're having variants after variants and outbreaks still to this day, even after all this education and information?
So certainly multifactorial, but variances, viruses are one of those, the most intelligent, I guess, organisms that exist. Oftentimes I know people don't like Bill Gates, but he always says the weapon that's going to kill you are viruses. And then again, I'm not saying I'm a big Bill Gates fan, but viruses are adaptable, they're intelligent. Given the opportunity in the right environment, they can mutate and change. And so the longer that they linger, the longer that they have the opportunity to infect in masses and continue to infect, they get smarter. The smarter they get, then we're continuously playing catch up, just like we did with this one. What we've done is play catch up with a virus that came along, and we will continue to play catch up, because if the more we give it the opportunity to mutate, the stronger it gets, the more evasive it becomes to our natural defenses, and it becomes even more of a problem for us.
Anyone else? Anybody else have any comment?
I mean, last I heard, we were now going to be naming the new variants after constellations and planets, which is absurd. This is really at the rate we're going. The genome of this virus is large enough such that it shouldn't really be mutating at the rate it does. But because of the degree of spread, it makes it, more conducive. The conditions make it more conducive such that it does mutate. And again, the longer this lingers, the more variants we're going to see, because again, it's going to be evasive to just the original wild type vaccine, which is still what we have, which honestly, considering, it's actually quite impressive that it's still effective, given that we haven't had to actually change the vaccine. This is still the original vaccine that was made. So it's actually still quite impressive that it's still effective.
Yes.
So at this point, we're lucky. If we're not careful, we're going to hit a variant that we're not going to be able to curb with this vaccine. And then we are going all the way back. We're going on. We actually, believe it or not, we've made a lot of progress in this short period of time. It's only been 2 years. It feels like forever, but it really, when we're talking about virology and infectious diseases, it's really no time. But I'm quite optimistic, and I always say I'm optimistic. Because if you look at where we were at the end of the third wave, we were actually at a good place. Had we reached herd immunity, where 95% of people were vaccinated, we actually could have gotten over this thing. And I still think we can, believe it or not. Because again, the vaccines are still effective. Whether or not COVID is here to stay, which right now at this point it looks like it is, we still wouldn't be in the acute phase of the pandemic. At that point, we could say, okay, we're living with this. Maybe we're going to need yearly vaccines. Who knows if immunity to this wanes. But we can get to a point where, things can get back to, what we knew to be normal. I don't think it'll ever go back to, normal, sort of like a post 9/11 world where things never really got back to, what it was.
Yeah.
But at least some semblance of normalcy we'll be able to achieve.
So I'm going to play devil's advocate here. So, so since we had our last discussion or last forum back in May, my family members have been doubly vaccinated. My parents, who were high skeptics, and a lot of it had to do with the culture, right? I'm Haitian, and they're like, no, I'm not going to get this vaccine. But then after having our discussion, honestly, I became a little bit more educated. And then I scheduled their appointments. And so my mom was, you know what? Yes, you're right. Let's get this done. My uncle got vaccinated, who was the biggest skeptic. However, now members of my family now are saying, well, I got vaccinated, but look, there's still COVID. There's still, there's still high increases of cases, despite the fact that there's at least 65% at least have had one dose in Canada. What do you, as healthcare professionals, what do you say to these people?
Well, I think that, I'm sorry, maybe I'll let somebody else first take over and take a stab.
Well, Shayna, because
Go
from a
ahead.
cultural background, from a cultural standpoint, and a lot of it stems from distrusting the healthcare system and the healthcare providers, especially. Well, and I'm only speaking personally from my family. What can we say? What do we say to these people?
I don't think anything I've had to say has helped at all because some of my family members have still not gotten vaccinated. And despite my efforts, some of them are still standing firm with the conspiracy theories that they've heard or the gospel authorities that they have in their life who have said contrary things regarding the vaccine. So they're standing firm on that. And I'm still trying to figure out what I can tell them. I'm giving them facts. I'm giving them the information. And I think I'm making some progress, but then they're getting reinforcement from these authority figures that they have in their lives or things that they've read, things that they've heard. So it's a battle at this point.
Yes, yeah.
I think what's apparent right now is that this is very much, and might sound controversial, but this is now very much the pandemic of the unvaccinated. It is now people who are not vaccinated. If you look at the new cases, about 80 to 90% of the new cases are among people who don't have the vaccine.
That's right. Exactly.
If you don't have the vaccine, you're up to 5 times more likely to contract the virus. You are up to 15 times more likely to end up in the hospital. You are up to 25 times more likely to end up in ICU. And you're up to 30 times more likely to die.
Yes.
People who are vaccinated basically don't die from COVID. That's basically what we've seen. That's what the data is showing us. So, worst of it, you're not going to die, right? Like, even if you say the vaccine's not working, you're basically, if you get it, you're not going to die. That's I think that's good enough for me. I don't know how it is for other people, but I think that works for me. So, yes.
So I want to ask you a question.
Yes.
I also want to play devil's advocate because I think this question was also posed to me. What about then people who have gotten COVID and have recovered from it and haven't passed away from it? Because I've been following the social media accounts, following what people have been saying, and some people are adamant on not getting that vaccine because they got over it. So that is their standpoint on it. What do we say to that?
So I think we have to remember that we are now dealing with a new variant as well. I think that that's not coming into equation as much when we have these conversations. So the anecdotes of, people were fairly doing well, especially young people with COVID in the first wave, is now showing that that is no longer the case. As Dr. Weredu, who's in the US, knows very well the situation that's occurring with regards to the pediatric, hospitalizations and ICUs. We are seeing younger people getting sick with this virus, especially with the Delta. The Lambda is not very far. It's another variant that's already kind of brewing out there. So we are not talking about the original virus anymore. Yeah. And so although of course I would love to hear all stories of, those who have had the virus and they did fairly well, they did not need to be hospitalized, that's great. But those are chances that we're all taking. And to which extent do we know how that virus is going to affect us? At this point, we don't. We can no longer rely on the fact that we're young. We can no longer rely on the fact that we're not a smoker or not obese. We cannot rely on the factors that we were relying on in the first wave. This is a different ordeal. As an emergency physician, I'm seeing it. I'm seeing young people, 40-year-old, 30-year-olds that I'm intubating and putting in ICU. So I'm not here to just speak of my own anecdotes, but being in conversations with many physicians, especially in the US and here in Canada, and healthcare workers, this is happening fairly quickly. So what I don't want to see, as Dr. Weredu had mentioned, that this is now the pandemic of the unvaccinated. Unfortunately, our communities are, have a large percent of individuals that are not vaccinated. What I don't want to see, and I've said this before to my family members and other people, I don't want this to become the pandemic of, Black people, right? I don't want this to become the pandemic of our communities. Because believe you me, if that occurs, then we're really going to suffer the brunt of this to a degree that I don't think that we realize. So we're just trying to watch out for one another, and we have to be honest with regards to what's happening. And what's happening out there is not, it's no longer anecdotals on Facebook. That these are people, like people are in ICU dying, ICUs are full. We're now transferring patients back and forth, trying to make space. It's happening in the US, it's gonna make its way here. It's happening in Alberta. In places that are low rate of vaccination, we're gonna see it more. And that's just a guarantee. Nothing more that I can say about that.
Yeah, and you know, it's possible that you didn't die, but there are cases of what we call COVID long haulers who have encephalitis chronic, have memory loss, they're foggy in their thinking, they have pulmonary fibrosis, they're hypercoagulable, they have clots, some have PEs. And if you're not the one who dies when you contract COVID, which one of your family members would you pick to die? And there is no way to know how people are actually going to react to this.
Nobody.
Right? There is no way to know.
No,
Unfortunately,
but
this thing is very evasive. We still don't know now which factors, we know which factors sort of like, you know, our predispositions that may give you a worst case, but we still, honestly, we have healthy, very healthy people who
are
never been sick,
dying.
who
Yeah.
die.
Or dying.
So,
That's the
yes,
issue.
so you,
here.
yeah, absolutely. And you contract it. Let's just say you're fine, you're asymptomatic, but you pass it on to a family member who unfortunately doesn't do so well. And let's just say
Yes.
worst case scenario ends up dying. Which one of your family members are you willing to pick and say, you be the one that I give it to?
That's right. Yes.
So
And,
it's,
but it speaks a lot about our society as a whole, about the self-centeredness of us
Yeah.
all. Because, you know, I heard a comment this morning, actually, and you know, someone was saying like, oh, I can't believe people still don't wear masks and they refuse to wear a mask. And then the lady responded to that. It's like, well, we're in a self-centered culture, you know? And so I'm sitting there with my kids, like, good comment, you know? And so it's it speaks to what Dr. Weirdo said about, you know, think about it. Which family member are you willing to put at the forefront for you, for what your decision is? So so now, okay. We know, you know, the vaccine has been around since at least December 2020. We know what it's done. We know that the numbers have declined, but, you know, like we said earlier, they are going back up because it's turning into the pandemic of the unvaccinated. In your practice, do you find yourself having to have these discussions with those patients who are unvaccinated?
Unfortunately,
Yes.
when I have those discussions, it's a little too late. Sorry, that's rude.
yeah.
It's
No,
you know,
not
I don't.
rude, it's the
Yeah.
truth, right? Yeah.
It's yeah, it is. You know, I'm not in no way am I trying to be rude or this. This is a bit of a dire conversation. I feel as though, you know, in the first wave and second wave, well, first wave mainly, there's been, you know, I participated in a lot of these talks, and there was a lot of optimism from the healthcare, you know, provider perspective in terms of just how we're all in this together. And this time around, it's a bit more, you know, like dire, where at this point it's like us pleading and saying, like,
Yeah.
we really need you to get the proper information, talk to your, you know, providers. Please get, you know, the proper information in your ears and get yourself in the place where you're protected, not only yourself, but protecting those around you as well, to the best of your abilities. Nothing is, you know, 100%, nothing is foolproof. We're not here to say that those who are vaccinated cannot pass the virus. That's not what we're trying to say. But if you are decreasing that chance of transmission, decreasing the chance of having an intense, you know, an infection, decreasing the chance of a hospitalization, decreasing the chance of death by you know, folds, not just like by 1%, then please, let's do our best. You know, I've never seen people, you know, have gone through some treatments that were like 20% effective just to make sure that they will not pass away. There are cancer treatments there that are, they give you a chance of living for 3 more months, and people will take it, and will take it because they just don't want to like pass away in 3 months. And here we are, we have something that is available, that's free, that is, decreases your chances of dying and decreases your chances of passing this around. And we're having a conversation with regards to, why should I take this, right? Like, why is it important for me to take this? That's where that's where I find this just a bit of a dire meeting this time around, right? Like, it's no longer, I don't even know where I was going with that. I think I'm just done.
I feel you. I feel you.
Yeah.
you could just end it right there where you were going. We all feel you. I'm exasperated. I am tired. And, I think a lot of people are feeling that compassion fatigue. And now it's unintended, but you have people who are like, well, I've done my part as a global citizen, as a citizen of a country, of the world. I have done my part. I've gotten my shot.
And that's
I'm pleading with
sad.
other people who haven't to do the same. And I can't do that. I can't get through to them. And people are frustrated. And they've polled people and they've asked, should other people who are not vaccinated, if they get sick, should they have the same treatment? And some people who are vaccinated are saying, like, up to 50% are saying, no, they should not get, the same level of treatment. And that's sad because, why should we feel that way towards another citizen? But it's hard not to, honestly, we're human. It's hard not to feel that way when you feel like, in many ways, you've done your part to try to fight this thing. There's only so much we can do. But as a citizen, this is all we can ask people to do. It's just do the small part, roll up a sleeve, get a shot, which we've done many times over. Vaccines are really why, many times over. Vaccines are why, don't make any mistake about it. Vaccines are why we can have the society we have today.
Yeah.
You can get on a flight today, here in North America, end up in Timbuktu, okay?
Yeah.
And vaccines are exactly why. Otherwise, we'd just be sharing diseases from continent to continent, and I don't even know how many pandemics would be running at the same time.
And because of vaccines, a lot of these conditions have been eradicated.
Yes.
So and that's why I'm a bit confused and I'm confused about the reluctance today about the vaccines that, that have come through, that have saved our lives. But yet with this one, for some reason, there's a lot of conspiracy about that. So, what's the weirdest conspiracy that you've heard about?
I know for a fact. So continue, sorry.
No, go ahead.
No, go ahead.
No, just to add to the last topic is just, I know a lot, I work with the Inuit organization, and I know a lot of the reluctance that some people have is geared towards fear. They're concerned as to why the vaccine came out so quickly. That's why they're so hesitant to take it. And the vaccine clinic that I'm working with, I've been working there since March, and we've done a lot of outreach to the Inuit and First Nations community. And I've noticed that some people were very hesitant, but now after a few months of seeing the effectiveness of the vaccine, or just knowing a member of the community that have gotten the vaccine, who are doing fine, who didn't have severe side effects, that has now given them a reason to get the vaccine. So I've seen some stragglers that are not coming in, who were first reluctant, like, no, I'm not getting the vaccine, but now have been coming in because they're getting more information. So I do think that some people, it is because of fear, but now that they're seeing other people get it and they're doing okay, they're now prompted and encouraged to get it as well. So I think it is working in some communities.
Okay. And so, and what about conspiracies?
Oh, yes.
You must, especially in your line of work, Shayna, you administer the vaccine, you administer the medication, so you cater to these people. So, we have the doctors who deal with, the after effects of unvaccinated, but you actually are the preventative aspect of it all. So
The most popular one that I've heard is that you have a chip in your arm as to like where at the administrative side. That is the most popular one that I've heard so far. Like they're tracking you. So the government is tracking you. But then my rebuttal to that is like, what about your phone? Like anywhere you go, you can actually be tracked. So why would they go to the point of putting a chip in a vaccine?
Right. Yes. Anyone else?
The magnetic one is what's funny. I've actually had a patient come in and say, well, and I heard it makes you magnetic, and put a phone to her head. It's like, well, see, I didn't get the vaccine and nothing happened. I was like, I got the vaccine. I put the phone to my head as well. There was no magnetic force around my body that attracted it. I mean, come on, people. Like, honestly, just please. I'm pleading. Just please disregard these sources of information. It's really like we're now just dabbling in the absurd. Like this is a whole other universe that we're dealing with. You can't compete with that, because as soon as you try to bring facts, they move the goalposts. You know, conspiracy theorists, they've already made up their mind that whatever they're going to believe no matter what. And it appears that, you know, the more information you give them, because of some egotistical feelings, people aren't willing to just accept that, you know what, I thought this way, I am wrong, and I'm willing to listen to facts. They're not anymore. They've dug in even deeper, you know, when you try to give them information and give them facts. So it's ridiculous, honestly. It's really exhausting. And there are people who have legitimate concerns, and I'm willing to have that conversation. You know what I mean? Like, let's actually talk about legit things. But if we're starting with magnetic force and 5G, and chips, like it's absurd. It is just absurd. That's not a conversation I can even have anymore.
Yes, absolutely. Dr. Kapan, any conspiracy, you are at the front line. Any conspiracies, anything? I mean, I know you said, you know.
I plead the fifth on this one. I'm not going to get into that rabbit hole. It's just not happening. Yeah, I plead the fifth on this one. I've heard it all. I've heard several iterations of different types of, you know, concerns and beliefs. And I try my best to just stick to, you know, data and facts and try to, you know, give people the information that I can. But sometimes it's hard. It's hard to get your head around it. I've tested, you know, I've had everyone who's had the vaccine around me test the cell phone theory. Has failed. I've not yet one person who has been able to keep the phone on their arm. So I'm not quite sure why. Maybe there's a predisposition to magnetic fields, but I'm not sure. I'm not sure what else to say about that.
Now, I've received a question, so you know, I'm just going to, you know, be asking questions from our audience or people who wanted to listen in. And so one question that I received was, what is in the vaccine that protects us against? And so this is a lady who has not been, she's not vaccinated yet. Okay, and so she's asking, so what is it in the vaccine that protects us against the COVID variants?
Okay. So I think we need to get back to like how vaccines work, right? Like,
yes,
so when
I was just going to say that.
I think that's a big one. Do you want to start, Dr. Weirdo? Do you want to?
No, please finish. Okay, I
can. No, start
sure.
it, and then Dr. Weirdo. Yeah.
Sure.
Yeah.
Oh, okay, so, my side. Okay.
Yes, please.
Go ahead. I'm going to mute myself. Go ahead.
Okay, so here's what a vaccine is, okay? So a vaccine is essentially giving your body a portion of a virus, bacteria, so that your immune system can learn and build immunity against that virus or bacteria, that pathogen. Okay, this particular vaccine, when we talk about mRNA vaccines, this technology has been around since 1989. It's been around for a long time. So what we had was, we had a technology, and the technology is simply this. We look at the viral, we sequence the virus's genome, okay? And then we look at the part the virus used to infect. And in this case, it's called the spike or the S protein. And then, you know, that portion of the mRNA, we copy exactly that. We give that portion, and this is synthetic, it's not the actual virus, this is synthetic. We give that portion to your body, okay? Your body takes it in, copies that strip of mRNA, makes the spike protein. It shows it on the cell surface. Your immune system sees it, makes antibodies specifically against the spike protein, which the virus uses to attack the body, and then makes antibodies against it. And so what's in there that protects us is that essentially it is that strand of mRNA that produces the spike protein, that your body makes the antibodies against the spike protein. And so anytime that the virus tries to attack your body, your immune system says, yes, I've seen this before. There's a spike protein. And what protects against the variants is that because the genome of this virus is so large, it's not able to mutate as quickly, specifically that spike protein. It still appears that that portion isn't that different. And so that's why it's been able to be effective against most of the variants, right? Essentially, that's what it is. Vaccines are, things that we give your body to basically have your body learn, teach your body, hey, listen, next time you see this guy, I want you to kill it. So your body builds what we call antibodies, and you can look at antibodies as bullets, okay? Antibodies are bullets that are specifically designed to kill a certain pathogen. And there's so many of them against so many things. Every day your body makes antibodies, like it is countless, okay? Against all the things that you're exposed to. Just think about your whole life. So that is what vaccines are, okay? A lot of people think vaccines are like a cure. Vaccines are not a cure. If you get sick, it's too late. The moment you're already sick, vaccines aren't really going to do much for you. Now we're looking at immunoglobulins, which might be able to help you. But immunoglobulins are antibodies, which your body would have produced had you had the vaccine. So if you're sick, we're behind the ball. If you're in the ICU, you're asking for the vaccine, there is honestly nobody on earth who can do anything at that point. I don't know. I think I'm going to stop there. I've been talking a lot. I'll let somebody else just add.
Dr. Capan, yes, please.
So just a couple things to add with regards to what Dr. Weredu said so eloquently. A couple things. So once the vaccine is given and does its job as stated, then the body breaks down the products of the vaccines. Okay, so about 2 weeks time, when it takes the time for you to form that immune system, kind of build up your B and T cells, which are your fighter cells, then the virus, the vaccine, that was given originally is broken down completely. So it doesn't stay on your body. You don't have that vaccine linger for months and years on end. So when people say long-term effect of the vaccine,
Right.
there isn't such a thing because the vaccine does not stay in your body. It is not embedded in your DNA. It does not go in and stays anywhere in your nervous system. That is not correct.
Right.
So we know that vaccines will initially kind of incite an immune response because that's what we're trying to get it to do. And that immune response sometimes can manifest itself in many ways. Sometimes it can be as strong or robust that it manifests itself in kind of an autoimmune response in your body. So people will have things like a Bell's palsy if that happens. Those are rare side effects, but they do because the vaccine kind of gets your body to say, hey, I'm trying to fight something here, get with me. And so it has this entire immune response surge. So that's a point. And the other point that I wanted to make as well was that over time, your B and T cells wane. Just like with any vaccine that you obtain, sometimes they wane. If you don't have a circulating virus in your community, then you don't really feel the effects of those waning antibodies. So when we talk about measles and rubella, why don't we see it? Because we don't have the circulating measles and rubella anymore. If we stop vaccinating our kids, measles and rubella is going to come back.
Exactly.
And then we're going to suffer the consequence of our own immune system having, like the B cells are going to be there, but they wane. So they may not be as robust or as reactive as they should be because over time they do wane. So that is two points that I wanted to make. But once your body recognizes the virus again, even though your B and T cells have waned, then it goes into work mode, right? Because you have the memory B and T cells. So
Mhm.
those memory B and T cells, your fighter cells, have a memory, so that does not wane.
Yes.
The active fighters, like the soldiers, are waning, but the memory of those soldiers of the virus is not waning. So once you get exposed to the virus, hence people who have the vaccine can still get the virus, then the body goes into crazy work mode. It starts producing those B's and T cells again. And that's what we're seeing, that people who are vaccinated are have a shorter period of time that they're dealing with the disease. They're not dealing with severe illness. They're not being hospitalized as readily. They're not dying as readily.
Okay, thank you so much for that.
Yeah.
Now,
And that also goes into the booster, sorry. And that also
I
goes
was
into
going
the
to ask
booster
you that. So,
conversation.
Dr. Weirdo, I was going to ask about the booster later.
Oh, yes. Okay. Yeah, sure. We'll save it.
But to Shana, to the point of Dr. Kapan, in terms of the side effects, what have you seen and what has been reported in your practice in terms of the side effects from getting, because I mean, we all know the Tylenol, the over-the-counter Tylenol also has side effects. So what do you say as the nurse who is going to speak to these patients face to face about that?
I literally explained, well, in less complicated words, what Dr. Kapan and Dr. Weirdo just explained. And I emphasize that if they are feeling any mild fevers, headaches, nausea, vomiting, that kind of stuff, I explained to them it's all part of the immune response. And they're very comfortable with it, and they accept it, and they understand that. And for people who've been getting vaccines, especially for the flu vaccine, yearly, they always explain to you that you'll get some sort of side effect, and people are used to getting that information. So they're not scared of that. We also have a hotline, and if they have any concerns, they call. So I've had phone calls from people who, hey, I've got my vaccine 3 days ago and I still have a mild fever. What can I do? What should I do? Or some people who sometimes may have had their vaccine like on Monday, but then end up on Wednesday having severe side effects, and then they end up getting tested positive for COVID. So there's that as well. And then there's also an explanation that has to go on, explaining to them that, hey, you know what, you just got the vaccine a little too late. The virus was already in your body, and just giving them that explanation and that history. So I find that people, once you explain the information to them, they're more receptive and understanding.
Okay. And so then do you, and now to go into the booster shot, because, Dr. Kapan and Dr. Weirdo explained it very well in terms that the vaccine doesn't stay in our bodies, okay? But then now, me being a nurse working in public health, we're getting a lot of calls asking about the third shot.
Yes.
The third vaccine now. It used to be 2. It's 2, except the Janssen vaccine. However, now there's a lot of talks about the third vaccine. Why? And why don't we need the third vaccine?
Why do we need it?
Why do we need it, or why don't we?
Well, I mean, Health Canada has issued a statement saying right now, there's not a lot of evidence to say that you need a third vaccine right now. So we're getting a lot of talks about, but we should get a third vaccine.
But I was doing some research on OPH, and they are giving to like certain immunocompromised populations. They are giving them a third vaccine.
Third shot.
Yeah, they are. For some people, they are.
Correct. Yeah. So for immunocompromised individuals, so the higher risk ones are the ones that are getting the booster for the reasons that we kind of explained, like the waning immunity. And unfortunately, those who are immunocompromised or have multiple predispositions to getting really ill are still the highest risk individuals, right? With regards to dying and ICU admissions, regardless of their vaccination status or not. Although the vaccination status does help them, even them, there are decreased chances of being hospitalized and dying. so far there is no consensus with regards to the booster. And I think, personally, before we talk about boosters for ourselves, we really need to look at vaccine, equity around the world, and we need to, then again, curb the whole COVID is not just in our countries. It's not just here in Canada. It's not just in the US. And if we're open, as long as we are opening our borders and people are flying and going around, so we really need to take care of each other in various places of the world and get people vaccinated, as many people as possible. I'm just going to put the anecdote of polio, the polio vaccine, who has helped us kind of like eradicate polio, has taken four vaccinations in order to reach that 100%-ish immunity with the polio vaccine. So if you have to look at the history of vaccines, some of them required more than one shot. If you look at all of our immunization routines that we do in children, measles, mumps, and rubella, we do all these vaccines that we do give on a periodic basis. It's for that reason as well, right? We're not just giving one and done for the most part. We are kind of gradually, continuously boosting that immune system. And so when people are, a bit up in arms with regards to the fact that we need 2 or 3 vaccines, we have to look at history as well. The more we learn about those viruses, we may need another vaccine, and we may need another booster as well if the vaccine continues to produce variants, right? So I it doesn't really give me a big hoopla. Yes, I know that people said 2 vaccines for Pfizer, but people did not also anticipate a Delta and a Lambda and another variant. So let's look at the data with currently what we're dealing with, and understand that we are in healthcare and everywhere with regards to this vaccine, this vaccine and virus. This virus, we are playing catch up. And so the quicker it goes, the quicker we have to adapt to the vaccine, to the virus. I really want to say vaccine all the time. Sorry, it's my head.
Vaccine.
Want to adapt.
See, they brainwashed her.
They brainwashed me. I'm indoctrinated.
You're indoctrinated. Yeah.
Look, what people, I want to make this point, and I think what people are seeing right now is science in real time. Okay, science is messy. And you are watching, because yes, you're seeing it happen live. Like, okay, no, now we need this, and now we need that. But what people have taken it to mean is like they have no idea what they're talking about. But science is messy. All the vaccines that we have, they didn't just come overnight and we knew the perfect schedule for them. They were tested. They were tested in people. We tested over time.
And retested again.
Yeah. And retested. And then I just recently got my my measles booster shot. Okay, because I didn't have immunity.
Yeah.
Although I got my shot, I got my shot 2 shots, still needed one.
Yeah. Yeah.
That's how really the booster comes about. Like Dr. Clent really explained it very well in saying that, yes, over time, your immunity will wane. And that's what the booster shot is for. Even though you still have memory, you have immune memory, you need those new cells to be produced to actually be able to fight the infection.
And who knows what's going on in your body at a certain point in time. We change, we age, you know what I mean? So it's really important for people.
And so, yeah, as you're aging, so do your B cells and T cells. They get old too.
Also age.
Well, I mean, I'm not aging, okay? Like, I don't know.
No, come on.
How about you? But...
I mean, you are. It's just like fine wine. That's all.
But in all seriousness, it's really, I think it's the whole premise is to understand how fast this virus is erupting, and not only erupting but learning, and adapting. And so you're talking about Lambda, you're talking about Delta. We're in a 4th wave. And there's a reason why we're in the 4th wave. Should we have been in the 4th wave after all this information? I'll be optimistic.
No, we shouldn't.
We shouldn't be. Exactly. We should not be after all this information that we've had. We all want to be out of it, but yet we're still in it. Do you think that, and you know what, both Shayna and Dr. Kapan, do you think that this fourth wave is the worst it's going to get, or have we passed the worst waves yet?
I hope it's not worse. That's my hope. With all the information that we have going on and the fact that a lot of people have been vaccinated, my hope is that this fourth wave won't be as bad as the third or second or even the first wave. And I'm hoping that the fourth wave will encourage other people to get vaccinated as well.
Yes.
I love Shayna's optimism. I'm a pessimist, so I'm just I'm
We're
gonna say
optimists. Yeah, we are optimists. I'm a devil's advocate.
good,
Yeah.
good. I love that. I think I
Yeah.
should, drink some of your Kool-Aid because it's so much nicer. I think that we are going to see another, straining wave. Then again, I'm just giving the example of our counterparts in the US. Like if you look at Texas, Alabama, you look at many states, Georgia and so forth, the data is really dire. It's really scary to see what's happening there.
Yes.
And so, that's just next door, right? Like, so what's going to help us here in Canada are, then again, the places that are highly vaccinated, the areas that are highly vaccinated, we're going to see less of that strain, but we're going to receive from the areas that are not as vaccinated. So a lot of patients will be transferred to ICUs in places that have less, more space in ICUs and so forth, like we're seeing in Alberta. Patients are going to be moved in, far places to just get an ICU beds. We're going to see more and more individuals who require emergency, surgeries, hence ICU bed after their surgery, have their surgery canceled, delayed, and so forth. We're going to see another wave of, people who require treatment for their, cancers and so forth, also being delayed. So those are strains that are in the back end, right? Like those are not strains that are just inflicting the individual. And I think I need to put emphasis on the fact that this is not something that is just about the individual. This is about us as a collective, as a community, as a people. So if we're starting to really look at ourselves and say, what am I doing to help my community, to help my fellow brothers and sisters? It's no longer about ourselves. And that's kind of how I look at this pandemic. What are we doing as an individual to help our community? And so if the answer is like, I'm wearing my mask every time I'm out, I'm making sure that I, vaccinate, I'm doing my very best. That is for me as a community, as someone who's protecting me and I'm protecting them. We're watching, after one another. Yeah. For me, that's what humanity is. And so I have a hard time understanding where we've gone astray when we're no longer watching for each other. And then again, maybe that's just part of history. We never were. But in my optimist self following Shayna will say that there is a part of us that is, we want to be part of community. We want to watch after our one another, after our brothers and sisters, our grandmothers and so forth. So what are we doing? The responsibility now is no longer in our government. It's no longer in, the healthcare system. The responsibility is to the individual. So let's make our choices.
That's it.
I think that's just beautifully put. But I think COVID picked the perfect time because it came at a time of social decline, because we are no longer our brothers and sisters keepers. We don't care for our neighbor. Most of us don't know who our neighbor is. We don't talk to one another. We've completely fallen apart as a society. And COVID saw this and said, this is the perfect time. And instead of coming together and actually coming to fight this thing, it's further divided us.
There's a lot more divide. Yes.
It is unconscionable. Just looking at it. It's actually quite sad.
Imagine. Honestly. Yes. Yeah. And so with that being said, thank you actually for these final remarks. I will go over to the questions before we end. Some questions have been asked before, but I'm still going to ask just for the purpose of our audience. There's the first one, and we did answer it earlier, but do I still need to be vaccinated if I already got COVID? Short answer.
So the short answer is yes, but I'm going to explain it because I hear this a lot. So I'm just gonna say a tidbit. I'm sorry, I'm gonna try not to go long. So the difference that we're seeing now with some data is that the immunity that you get from having had COVID is robust. So most people, if you're young and you've had a fairly severe illness, you have a pretty good immunity for about 8 months or so that we're seeing with people who have had COVID before. What we're also seeing is that that is quite variable. So it is not standardized across people. Different individuals have, waning immunities that just kind of goes away after 3 months. We're not sure if it, and other people 4 months, other people 5 months, other people 8 months. So we cannot quite predict who you are, which one of you has the longer immunity. That's one. Two is that once you do get COVID as well, what data has shown so far, some studies have come out to say people who have severe disease seem to be the one who are more protected with regards to that immunity. So if you had mild disease, you don't seem to have the same amount of robust immunity as someone who had severe disease. So then the question really is, do we really want severe disease from COVID, not knowing what the long-term effect of COVID is? That's one. And two, we don't know if you had mild disease, you may not be covered at all, like 3 or 4 months out of having had COVID. Hence the reason for the vaccine. The vaccine seems to give you a fairly standardized immunity for a long period of time. And the boosters, of course, will be helpful as well at some point.
Hey,
Also, keep in mind the variants, because even though you had flu the year before, you still need your flu shot the next year.
There are different strains
keep
now.
that in mind.
So
exactly. So we don't know which one you had.
Okay. Now, next question was, if you had 0 side effects from either vaccines, does this mean that the vaccine is less effective for that person?
Not necessarily. No. There's no correlation.
No.
No, you're just lucky. That's it. You're just lucky. And honestly, most people don't really have that robust a reaction. It tends to be more towards the second one, because your body does have the memory. And so you have that more robust immune response with the second shot, usually. But some people don't have that, but that's okay. That doesn't mean they don't have immunity.
Yeah, that's it. I didn't have crazy symptoms. Nothing on the first one and a headache on the second one. So
I had nothing. My parents had nothing at all from both.
Oh, you must have got the placebo.
There's no such thing. There was no placebo. Let's please, Dr. Weirdo, please don't add into
don't start. That's another conspiracy.
It's a joke.
Shayna knows. I've worked in the COVID assessment centers. I've worked in the vaccination centers as well. They come in their fridges. They were drawn from the same batch. They're put into syringes. It's so controlled. It's insane. There are no placebos in there. Yes. So if you didn't have any reactions,
don't run with that, everybody. Not at all. Okay. Don't listen to that. There is no. There's no placebo. But
this is not an experiment.
Next, people with mixed vaccines, and I'm not sure if we can. We might have to refer this person to AirCan, but people with mixed vaccines face a bit of uncertainty when traveling abroad. If so, then why is Canada mixing the vaccines?
Yeah,
we don't know.
What issues are they running into with the mixed vaccine?
Some countries don't accept the mixed. Yeah. So when they consider full vaccinations individuals who've had 2 of the same vaccine. So some countries won't accept you going to their countries if you've had 1 of each approved vaccine. Yeah. I mean, these are regulations that are above us.
Exactly. I think that's less of a Canada thing, and it's more an international thing. Any country can make their rules. It's their borders. They can accept. Yeah. They can say you need a 3rd dose before you come, and that's just country specific. But the data does show you still have immunity, even if you get the Pfizer first and then the Moderna second. The Moderna tends to give older people, apparently older patients. That's what the data is showing. Better immunity and less chance of a breakthrough infections, which is important to note.
That is correct.
Okay. And then the next question is, can humans get the coronavirus from animals? dogs, or cats?
I don't know. Does anyone know this?
I have not
My
seen many studies that have, you know, made the correlation with
yeah.
getting COVID from your pets. Yeah.
Yeah.
I know that,
That-
you know,
that
the
I'm
theory
not
of where
sure.
COVID comes from, I know that, but I have not seen any studies that have, you know, made positive correlation of even dogs getting COVID or cats in the home getting COVID. So I can't really comment to what
Yeah.
that is. It would maybe the person can expand a little bit. Where are they getting that particular information? Is this something that they saw somewhere? And I'm happy to like look into it and get back to them.
Can this person expand on this question, please? In the meantime, I'll ask the next question. Is there a possibility of being tested to make sure that you have been vaccinated? So blood tests or anything like that to show, oh yeah, there's a vaccine in there.
So then again, the vaccine does not stay in your body, right? Like if the blood test shows that you have signs of immunity, like when we do blood tests for, you know, tuberculosis, or we do some, you know, tests for tuberculosis, skin tests, and then so forth. It just shows signs that you have immunity. So the PCR test, you can have a blood test that shows that you have antibodies, but that's about it.
Like a serology. Yeah. And just because you have antibodies doesn't mean you got them from a vaccine. You could have gotten the infection and be asymptomatic.
You can have antibodies from infection. So that's possible. The only thing I can show.
Yeah, but there's no way. Just please, if you get the vaccine, have the papers signed. Keep your papers. Make sure it's documented, please.
Yeah, that's right.
Because
in Canada,
once you leave that place,
Ontario is coming up with a passport.
Vaccine passport.
For and Quebec already has theirs.
And even before that, you have document, like all of that is computerized, right? Like you received an email confirmation of your vaccine. Like there is.
I didn't get no email. I just got a paper.
You know?
Yeah, it's not all locations that
I
have.
just got a paper.
Yeah,
not every.
It's certain.
You got the card though. You got
I got the paper. That's right. Okay. I got the paper. Yeah, with both. Yeah, with that says the date and what I got. Yes, exactly.
There you go.
Is there?
But all of that is in the system, in the COVAXON system, right? Like that's where they're going to extrapolate a lot of the data.
Not everything is entered into COVAX. I know my clinic doesn't, and even the hospitals as well. They don't insert their vaccines into the COVAX system.
But the hospital will have that data as well.
Yeah, tracking it.
Yeah.
Well, they have their own charting system, and they are giving vaccine proofs from the Ministry of Ontario. So there's that. And once the vaccine passports come along, everything will just be uploaded because the ministries are aware that not all locations are uploading everything.
More standardized. Right.
I see. So then it will be standardized the moment that the passports will come amongst all clinics.
Yes. Yeah. And I also think the vaccine passports are encouraging people to get the vaccine as well.
Amen. Yes, exactly.
I don't even know why we call them passports. It's just your proof of vaccine. It's just your card. It's your vaccine card. I think the word. I don't know why the word passport is so controversial. All of a sudden, everyone's like, "Oh my God, passports!" Like,
I'm not sure. The passport, the word passport. There's been a few political, I guess, terminologies that have really viewed, you know, why this is being done and why it's important. But yeah. I have to say one thing though, and then I'm done, and then we can say bye. One thing is that once I do not believe, then again, people who are vaccinated are not, you know, free willy going everywhere without their masks, you know, walking around and be like, I'm vaccinated and I'm free. That is not the case. COVID still needs a multi-layer approach, still needs, you know, wearing a mask when you're indoors, making sure that you're, you know, washing your hands, making sure that you are, you know, you're protecting others and yourself as well. Those measures are not going to go, and they're not going to go away because you've had 2 vaccines. So because you've had 2 vaccines does not mean you're, you know, coming in close proximity with everybody and, you know, gathering in crowds with other people that are vaccinated. Does that decrease your chances? Sure. But I don't believe that that's the right approach either. That is not the right message to send politically to anyone. And from a health care perspective, it is not correct. So people who are vaccinated, I plead you, please keep your mask on, keep precautions when you're indoors. It's good to enjoy your outdoors, no problem. Keep yourself socially distanced because that's also important. You get to have a bit more liberties because of your vaccination, but let's not abuse of those liberties either, because COVID is still going to affect us all.
It's still
But if
happening.
98% of us get the vaccine, we can. 98%. That's the
But
magic
Dr.
number.
Weirdo, like the thing is, you
We
said
can
it
do whatever we
before,
want.
but
You were at 90% before, now you're 98%.
Now I'm at 98%, yes. Yes.
One last question though. I have